A panic attack feels like to me inside if someone were standing there holding a gun to your head and saying, I'm going to kill you right now. And you know how your heart would be racing or your body would be reacting. That happens to me for no apparent reason whatsoever.
A feeling that I could only describe as a wave coming over me would like envelop me, and I just had to make way for the door. And if I couldn't find the door, then it just got worse.
The first attack may have lasted a matter of minutes, but it seemed like longer. I mean, when you're going through it, it seems like it's forever, and it's an awful feeling. It's hard to explain because your whole body just isn't yours. It's like being in somebody else's skin.
Every one of us has a 15% chance of developing an anxiety disorder at some point in our lifetime. For some 5 million Americans, it will be panic disorder. If you believe you or a loved one may be suffering from panic disorder, you're not alone. You've also made the right decision. Seeking help is the first step to feeling better.
Usually, the person is doing something ordinary for them. They're at work, they're in their car, when all of a sudden, for no obvious reason, the person begins to feel their heart pound, they can't catch their breath, they feel like they're suffocating and begin to hyperventilate. This comes on in a crescendo of increasing symptomatology that usually lasts somewhere between 10 and 30 minutes, so it gets worse and worse.
Men will often come into an emergency room convinced that they're going to have a heart attack. And all patients will often present to primary care doctors with complaints of stomach upset, chest pain, shortness of breath, quite convinced they have something really seriously wrong with them physically.
My attacks felt like I was drowning, a suffocation feeling, and heart attack symptoms, like a severe pain in my chest and numbness and tingling down my left arm and wet, clammy palms.
I drove to my children's preschool, and there they called an ambulance. They thought I was having a heart attack, and so did I. And I went to the local hospital.
It's interesting that having a panic attack is the one psychiatric event that's most likely to motivate someone to go for help. But usually those people go to emergency rooms believing that they're having a heart attack or a stroke, and the diagnosis of panic disorder is not actually made. About 30% of the population will have an isolated panic attack at some time in their life and never get another one. To make the diagnosis of panic disorder, we require two things. One, that these become recurrent, that the person begins to get them over and over again. And second, that they begin to produce distress in the person. That is, they start anticipating when the next attack is going to come, so that the fear of attack itself becomes part of the person's life. And then when they have those things, then we call it panic disorder.
The panic attack only will last maybe 2 or 3 minutes, but then you're always thinking in the back of your mind, when's the next one going to hit me? Is it going to hit me in a few minutes? Is it going to hit me in a few hours? Is it going to hit me right again?
Everybody has anxiety. Anxiety is normal. I mean, we couldn't function without anxiety. It warns us of danger. It helps us prepare for things. I mean, anxiety is a critical part of living. The difference is when we talk about anxiety disorder, we talk about panic disorder, we're talking about pathological anxiety. We're talking about an anxiety where the person is totally aware that their anxiety is irrational, that they're totally aware that there's something wrong, that they begin altering their lives because of it. I mean, it's very different. And I think where we are now with anxiety is where we were with depression 10 years ago.
Because of the fear of attacks, people suffering from panic disorder may avoid the situation where the attack first occurred, or eventually become afraid to go out in public at all. 60% also suffer from depression.
The person with panic disorder becomes afraid to go anywhere where they might have a panic attack and not be able to get help right away. So they start avoiding things like being on a subway, or being in a car on a bridge in a traffic jam, or being in a shopping mall when they might not be able to find the exit quickly to get out. In the worst case scenario of this, the person is afraid to leave home.
I used to stand in the bedroom and stare out the window by the hour, thinking, why can't I be normal? And then I'd turn around and say, well, why can't people accept me the way I am?
Started in a department store so I wouldn't go into department store. Then I had one in a grocery store so I avoided grocery stores. I had one in church so I wouldn't go to church. It became like a domino effect, and pretty soon I wasn't going anywhere.
I never had any intentions of staying in my house, but I just came home from work one day, and one day led into another day, and another day, and another day, until I was actually in there for 8 years. I never left my house for 8 years. At first it started out where I could still go to the mailbox, I could still walk out front, and then as time went on, it got less and less that I could do. I couldn't walk to the corner any longer. I couldn't walk down to the mailbox any longer.
I was my own guard and making myself a prisoner, myself. It was all myself. And the worst part of it was not knowing what was wrong with me. That was the worst part of all, because I thought I was losing my mind.
The worst part was you don't feel normal when you're suffering from panic disorder. You let people down that you love, and then you feel guilty. And then that just leads to depression, because if you're not feeling good about yourself, you can't feel good about anybody else.
It's a terrible thing to watch, to watch someone that you love and be able, not to be able to help them whatsoever, just not to be able to do things that you want to do for them that you know that they would like you to do. And it's a very, very helpless feeling.
When we first went for counseling, Teddy said, you've got to do something because you're killing yourself, you know. And I said, no, I'm not going for help because I'm not telling anybody all these weird problems. I didn't want to be bothered. And I was afraid.
The problem is, you know, we're talking about one of the most potentially devastating, crippling, and yet treatable disorders. And yet, although we can treat up to about 90% of people that have these problems, there are probably less than a quarter of the people who have panic disorder that have been accurately diagnosed and treated.
One of the joys of treating panic disorder is that you can make an immediate and real difference in people's lives. The myth that psychiatric conditions like panic disorder never change or you can't impact them is just that. It's among the most treatable conditions, and people can have real optimism and enthusiasm about working with it.
There are really two general approaches to treatment of people with panic disorder. One involves pharmacotherapy or medication treatments. The other involves cognitive behavioral therapy.
We know now that there are two basic treatments that work. We know cognitive behavioral therapy works, where we actually teach people how to look at the symptoms and how to reevaluate them, how to change their thoughts about them, and how to face them, and how to actually confront the symptoms and become desensitized. And we know medication works. And we know that although the studies are still early, certainly anecdotally, we know that they work together. For most people, medication and cognitive behavioral therapy in some form is what's going to work.
Well, the first class of drugs that were shown to be effective in blocking panic attacks are called the tricyclic antidepressants. And these are sometimes still used.
These were effective antidepressants and effective agents against blocking panic attacks, but had a whole variety of side effects that often made long-term and even acute treatment difficult. Patients had trouble tolerating them at doses that were likely to be effective.
Then about 10 years ago, it was shown that drugs of another class called benzodiazepines, which include a drug called alprazolam or Xanax, are also effective in treating panic disorder. But it was realized very quickly after they were introduced, they do have an important problem, which is that people have trouble stopping taking them. So what we've been looking for is a class of anti-panic medication that would be well tolerated, that would have a favorable side effect profile, but would not have this problem of inducing physical dependency. And that's what the newest class of drugs are, the drugs that we call SSRIs.
More recently, the use of the newer antidepressants, the serotonergic antidepressants like paroxetine, have become first-line treatments for panic disorder and have proven effective in blocking panic attacks, in decreasing phobic avoidance, and importantly are well tolerated for patients both acutely and over the long term. Remember, most patients who take these medications are going to need to take them for long periods of time.
One of the benefits of using Paxil or another SSRI is that it will treat not only anxiety, but also depression. And so there's a little bit less worry about whether, in fact, you are masking, for instance, a depression or exacerbating it by using a benzodiazepine, because this medicine will work not only for depression but also for anxiety.
Paxil is effective for treatment of people with panic disorder. There are a number of large clinical trials now demonstrating its effectiveness and widespread clinical use. It's been effective at blocking panic attacks, at decreasing patients' anticipatory anxiety or worry about having panic attacks, and in diminishing their avoidance of situations they associate with panic attacks.
What you have with Paxil is a medication that I think is going to really have a tremendously important impact, a positive impact on the lives of people with panic disorder. It's a safe medication. It's one that's very well tolerated by patients. We can reassure the patient, as we never could before, that it can't cause any harm. We could never really say that with tricyclics, because the tricyclics can sometimes do things that are harmful. In addition to that, we can give the patient the peace of mind to know that if they want to stop the medication, that it's not going to be difficult to stop the medication.
It's important for people to understand that panic disorder is not just something in people's heads. This is a serious illness. It's a brain disease. It has genetic components. We know there are biochemical components, or else the medications wouldn't work so well. So it's really going to be important for us to really let people know that it has to be taken as seriously as any physical illness.
There is light at the end of the tunnel. There is. I know it's a long road and you feel alone, but there's no reason to. If you're properly diagnosed and you have the correct doctors, I mean, they can do wonders. And it's great when you come out the other side. It's kind of hard when you first start.
I started feeling better immediately simply by knowing that I wasn't the only one, and simply by knowing that there was this doctor and this psychologist and all these other people whose telephone numbers I had, and I had a lifeline now. I wasn't alone.
We have our 30th anniversary coming up in May, and we're going on a cruise. And the great thing about this is that 2 years ago, it wouldn't even have been a possibility to even think about it, and now we're doing it. And it's terrific. It almost makes it all worthwhile.
My advice to other patients with this problem would be to seek help, to talk about it. Don't be ashamed to admit you have it. And the more you talk about it, the better off you'll be.
I really believe that with the right treatment, the Terrys of this world could go on to live productive, normal lives.
Panic disorder. You don't have to live in fear.